Hello, everyone, and welcome to this audio podcast. This audio podcast series is part of the Segmental Scruples series or edition. This audio podcast is part of a Rampage Sonar. This audio podcast as part of a Blitz Logistics, and this audio podcast as part of a Storm Logistics production. In this audio podcast, a little bit around the sort of guidelines and frameworks in around sort of transfusion sort of practices. So whilst there is now whilst there are now whilst there is now sort of more awareness of CKD, chronic kidney disease, and sort of early referral strategies for management of recipients or patients with markers of renal disease. Patients who are due to be referred are or can be symptomatic or who have a sort of CKD as a comorbidity should have HB the hemo should have hemoglobin assessed and but scientists or transfusion practitioners enhancing sort of skills advancing sort of skills and enhancing skills should uh, uh, should uh, should look to review guidelines and frameworks, updating understanding relating to strategies for transfusion therapy, and should become familiar with for example in around the National Institute for Clinical Excellence, or NICE sort of definitions in around renal anemia. Um, in some in some data in some works, a threshold of 11 grams per deciliter to define anemia, define anemia and the need for treatment thereof used in CKD and chronic kidney disease, and a cross reference with guidelines used by or had been used by the European best practice guidelines and kidney disease quality initiative. Now, the threshold for anemia or a low hemoglobin, where where data has informed that a threshold lower than sort of 11 grams per deciliter is a little is a little is a little sort of is a little is in sort of current day practices, is a little bit generous in around sort of in around sort of re, in sort of renal anemia. Thresholds that are lower than, for example, 10 grams per deciliter 10 grams per deciliter, for example, between males and or males and females, is sort of where sort of a more where sort of transfusion guidelines have for example informed. So reviewing guidelines is a good start, and recommended to ensure that practices are generally inclusive, and patients or recipients with, for example, CKD stage 3B, 3B and CKD, and where CKD stage 3B, and have hemoglobin less than 11 grams per deciliter, um, should be tested for or screened for renal anemia. The mean hemoglobin declines as renal function reduces in subsequent stages of CKD or chronic kidney disease, and this is also when renal anemia, or when anemia then catches up with additional clinical symptoms or symptomologies. Um, So although RBTs in the United Kingdom is now very safe, and indeed is very safe, and most of the serious adverse events originate in the that would originate in sort of in amongst hospital environs rather than that most of all the serious sort of adverse events sort of tend to originate in sort of in amongst hospital environs rather than actual blood transfusion centers. However, ensuring a safe and effective blood supply remains has remained sort of essential. Um, this then requires sort of there is a requirement in around a combination of high quality donors or recruitment and selection and infection screening, serological investigations and testing, and blood component and blood component production. And the four UK blood services. So, for example, NHS Blood and Transplant or NHSBT, Northern Ireland Blood Transfusion Service, the Scottish National Blood Transfusion Service, and the Welsh Welsh Blood Service all maintain sort of the common or have the common sort of standards for blood for in around blood screening and blood products. The joint UK Blood Transfusion Services, or the UK BTS, and the joint sort of professional advisory committee, so that's the UK BTS and JPAC are responsible or have been responsible for producing the guidelines for blood transfusion services in the United Kingdom, often known or has been referred as the Red Book. In sort of retrospectively around 2011, the United Kingdom Blood Services issued around 2.1 million units of red cells, RBCs, 300,000 platelet doses, and 288,000 units of FFP or fraction frozen plasma, and 126,000 units of blood component referred to as cryoprecipitate. That draws this audio podcast to a close. This has been an audio podcast as part of the Segmental Scruples series or edition, an audio podcast as part of the Rampage Sonar, and this audio podcast as part of a Blitz Logistics, and this audio podcast as part of a Storm Logistics production.